care. I know that you launched the Free Wishes Project. That was in 2013. But obviously at the same time, it must be very intensive. What's it like working on intensive care?
Well, it's very energizing and
Hmm.
sometimes very draining, but it's an extremely positive environment. It tends to be fast paced,
Hmm.
very interprofessional. Each patient has about 9 different professionals helping her or him
Hmm.
to improve, try to survive and recover.
Hmm.
And it's technologically heavy.
Hmm.
So the pace is fast, the communication is quick and complex, and it's when it runs well, it's like a family
Hmm.
actually. And critical care has come a long way in the last 30, 40 years, I must say.
Hmm. And what inspired you, Deborah, to become a doctor? Obviously, every doctor has their own agenda in terms of, helping people in the A&E, you being intensive care, and obviously being a very notable and high influential doctor at the same time, working on a huge scale. But what was your inspiration to become a doctor and also to do the work that you do?
Well, I always loved sports and understanding health,
Hmm.
not illness. I was
Hmm.
interested in anatomy and physiology, healthful activity, behaviors, and food, and actually was studying physical education or kinesiology and
Hmm.
working in the medical library part time to help put myself through school and looking
Hmm.
at some of the medical books and journals. I thought,
Hmm.
wow, this is interesting. The other side of it, the illnesses and diseases, and just started to volunteer
Hmm.
and apply. There was no single aha moment, or it
Hmm.
wasn't a long held passion. I thought this looks like a career where I could hopefully make a difference and balance all healthful activities with the important knowledge that's required to help people get better when they're sick and stay as healthy as they can be for as long as they can. That's how I got
Hmm.
into it. Really.
No, absolutely. Now, obviously, being a doctor, you will have more knowledge than I would. Now, recently we interviewed Dr. Robert Langer from MIT, and we asked him a very direct question: is there a cure for cancer? Is there a cure for is there a cure for cancer? And he said, well, we're working on it now. In terms of you, obviously being in intensive care, people say, well, we have all these people that have diseases, but at the same time, human beings, even myself, at times where we like to cheat, where we eat salty food, we eat sugars, etc. And obviously, it's very available for us at superstores. That we end up getting to a point where we end up regretting later when we get sick. Do you think, in your opinion, as a doctor, that needs to change for us to also have a healthy lifestyle?
I think it's in everybody's best interest to live as healthy a life as they can.
Mm,
But even with that said, there are inevitable illnesses that befall people, malignancies and trauma, etc.
mm,
So critical illness is not always preventable, and of course, death isn't one of the two human universal experiences: being born and dying. So there's some inevitability to being unwell at some point, no matter how hard people try to live with
absolutely.
health.
Absolutely. Now, in terms of the research that you're discussing at the moment, in intensive care, what is it like in the terms of being? I mean, do you get emotional when you know someone is on their last legs, their last lifeline? How do you deal with that sort of trauma for you as a doctor?
Well, as an empathetic person, and not all clinicians are that way, I definitely feel the pain. You bear witness to a lot of suffering
Hmm.
when you're caring for somebody in a state of serious illness, and when the time comes for death, when it is inevitable. um, I've got a very high degree of compassion, and that's fueled a lot of our practice and a favorite aspect of my teaching. And we've done a fair bit of research on trying to make end of life care as comfortable as it can be, given the sadness inherent in it.
Do you get emotional though, doctor?
I do sometimes. I do. Yes, I definitely do. A life, any life, every life is of value, and try to always recognize everyone's inherent dignity. And much of our work to try to recognize the individual who's passing and bring comfort to the family and friends is really based on humanism and the importance of upholding humanism, staying connected,
Mm.
and recognizing our shared humanity as a practitioner with the patients for whom we care. Those are some sort of guiding principles or views that I hold and have practiced and taught and done research with.
And also in terms of memories and stories that you've had in hospital. Obviously, for legal reasons, you cannot say their name, and that's fair enough. But in terms of you know a memory that you've had that you think that has been really worrying, do you have them? Do you go back at home and think that I wish you could do more? Because obviously, as a doctor, you can only do so much in terms of comfort, as you say. But do you think do you ever feel like you can do more than what you can actually give?
Um, I put in 110% what I do, and I try not to live with regrets. Dying obviously is sad to watch and bear witness to, but with our Three Wishes End of Life program, it's as meaningful as it can be to recognize the individual and to try to surround that person with the things or the people they care most about, and to call forth that clinician compassion. And that is uplifting at sad times, which might seem ironic, but it is incredibly meaningful to engage in that way.
In your job as well, obviously being in intensive care, does that also make you very humble, knowing that life can be taken away just like that without a blink of an eye?
Indeed, indeed. Life is so precious, and there's reminders, daily reminders of how precious life is. And I think can do a lot to help people working in fast-paced settings like the ER or ED, as well as the ICU, to remember to try not to take anything for granted, and try to live and be your best self each day. Appreciate what you have. It is humbling, absolutely.
Now, as a doctor, obviously you would have advice for young people out there that, end of the day, as we're talking, life comes to an end regardless. But there are going to be times where people can do things in order to prevent that from happening at an early stage. What would you tell young people out there that are watching this that don't that can later stage that situation to delay that situation to a later on in life? That doesn't have to be so early.
It's a tough question. Try to make some good choices, or the
Hmm.
best choices that you can. Try not to take undue risks with your health.
Hmm. Hmm.
Motorcycle, very dangerous. Fast car driving, very dangerous. There's some clear risks,
And what
and
sort of
that
and what sort of patients do you have in the clinic, in the life intensive? I mean, obviously, people with diabetes, people with cancer. I mean, what other people that are at the end of their death that you're there?
the unit where a McMaster affiliated hospital is mixed medical and surgical ICU. So patients who've undergone operations, people who've come through the emergency room with complex medical conditions, a lot of the chronic diseases that you mentioned. A lot of intensive care in our country is regionalized. So persons with complications of cancer may go to one of the regional hospitals nearby. Trauma, neurosurgery, cardiac surgery patients would be regionalized to be cared for in a different unit. So there's some subspecialty within the specialty of intensive care as well. So our unit would be surgical patients, a lot of complex kidney disease, complex lung disease.
And in the UK here, Doctor, we have something called the NHS, where there's lots of people in citizens and public that say that there's a lot of shortage of doctors, and at the same time, doctors are not paid enough, etc. And also in terms of A&E. Do you think, in your opinion, healthcare should be improved more?
I couldn't speak for the entirety of healthcare in the country or specialty, and wouldn't generate any specific recommendation, but health is precious, as we know.
Mm,
And even if we look at it as a commodity, um, in places where it is a right to have good health care, we know there are some inequalities, and that inequitable access is a problem. And in some situations, the ability to pay or to go to places because of geographically dispersed individuals. There's so many problems and concerns with the whole healthcare system. I couldn't speak to any specific recommendations about compensation, I think is what you're asking about.
Yeah, I mean, what I'm trying to say is, I think it's more support, more government support, because there are doctors in the UK that are working well over time and are exhausted. Nurses, in the UK that are really, spending so much time trying to make sure that the patient, and giving their time and effort and energy, and a lot of people out there, not myself, but just other people who are saying that there should be more support towards doctors. And I don't know what it's like in your hospital. I just thought if you have a different opinion, or maybe a same opinion.
Mm-hmm. Being in healthcare today, any year is stressful. There's, especially post-pandemic, high degree of burnout. There's moral distress is fairly prevalent. There have been turnovers, I would say, in the several healthcare professions after COVID specifically.
Hmm.
And it would be great if there could be more work-life balance, which could be achieved perhaps with relatively more practitioners for the same population
Hmm.
to serve patients fully and try to maintain the health and the endurance and retention of well-trained healthcare practitioners. More of them, more graduates would be.
Now, if ever in your life, Doctor, obviously being on the front line is, you're always on your feet. Now, has there ever been a time where you've decided, I've had enough, this is something that's too overstressful for me, but obviously at the same time, you know that you've got to keep pushing and pushing? Have you had them moments in your life, Doctor?
I don't believe I've had moments of got to give up or this is too much. I just have always been very passionate about what I've been doing, and that's been very, very energizing. So passionate pursuit of what is important to me in my career has been, I don't know, that's just been a drive, I guess I've tried always to strike a balance with exercise and activities outside of the workplace, but I'm a work in progress in that regard on the work life balance, I must say.
No, absolutely, Doctor. Now, in 2000, during the COVID pandemic, you was awarded the Lifetime Achievement from the Society of Critical Care Medicine for your contributions to the N95 masks. What does that award mean to you, Doctor?
Well, it means a great deal, and I think many people have worked on the N95 mask initiative. I was a minor player in that initiative, but the Lifetime Achievement Award from that society is really the reflection of a large number of people who've shared my vision to try to improve the care and the outcomes for critically ill patients through clinical research. So it's really a reflection of great teamwork from the interprofessional colleagues with whom I work, the collaborators, the students, the trainees, my tutors. We learn so much from our patients and families. They're the ones who inspire us to do the work. So it's really a collective honor when.
And obviously, you being a pioneer in your industry, and it's great to have that discussion with you. What advice would you give to young people out there that want to follow in footsteps in terms of being a doctor or being, being a clinical researcher? What advice would you give them?
Well, it'd be great if you could find and follow your passion. I think that's the fuel that keeps people going. Sometimes it takes a while to find what it is that we're passionate, and those passions can change. And when they do, when they die out, it's good to let them go. But I've always found it interesting to talk to people about what they're passionate about and why, and that's been great for me to reflect on my journey. So I think there's no straight line. Careers are non-linear. Mine certainly wasn't, and most people, I think, have ups and downs and some curves that you navigate through life. So giving advice is very challenging, but be ready for the ups and downs. Be ready for the curves in the navigation to one's career. Is some general comment.
No, and also, Doctor, if you could please tell me about the Free Wishes Project. Obviously, you began the Free Wishes Project. What was your agenda in that, and also at the same time your aspirations?
Mm-hmm. Because the ICU is a set replete with technology, very unlike a home setting. And most people, if they're able, would say they'd like to die at home, surrounded by things or people that are somewhat familiar. However, at least in many places in the developed world, people die technologically supported and institutionalized in some way, typically in a hospital. So the motivation for that was to try to ease the grief associated with a loss that was pending and support the family members, bring some comfort and to them, and then call forth some clinician compassion. And the general idea was to learn about the patient as a person,
Mm,
recognize their individuality,
mm.
go beyond what their diagnosis was.
Absolutely. Now, in
Not
terms of
what
no, Dr. Cook, after you. Sorry, I interrupted you there. Please continue.
I was just going to say, we sometimes find ourselves talking about patients in terms of their room number
Mm,
or their ruptured bowel,
mm,
and know a lot less about them as people. So coming to know who they are as people helps us connect with them. And then the Three Wishes Project involves eliciting from patients, if they're able, more commonly family members, ideas for what could make the passing more meaningful
mm,
or more comforting. So things like special taste of spaghetti sauce or cappuccino under somebody's tongue, bringing a pet from home, one last trip outside, even with the oxygen and the ventilator,
mm.
um, allowing connections that might not otherwise take place, facilitating wills and things that may have been forgotten but ideally would be dealt with. Most of the wishes are free, it costs nothing, and most of them are profoundly simple. Profoundly
No,
simple.
no, I understand, Professor, and it's great to have this discussion with you in terms of advice and all the great awards that you've won. I want to move on to more AI, and the reason why I say that is because, as you know, Doctor, AI is changing the world. What's your thoughts, first of all, that AI has been used in medical research, and at the same time AI has been implemented around the world in all different genres? Do you think it's a good thing, or do you think is AI should be used carefully?
Well, it's inevitable. It's here to stay. It's got incredible advantages. And like any new initiative, it may have unintended consequences as well as some excellent, useful consequences. So the unintended consequences that I am concerned about in healthcare have to do with retaining humanistic care
Hmm.
in an era that is increasingly digitalized, where often we know a lot more about patients in terms of their lab values, their x-rays, CT scans, their past medical history. We have short forms, we have 3 4 letter acronyms, we have briefs, we cut and paste information about them. And a lot of that digital information can be very, very helpful if used wisely with the aid of AI, I am sure, for probabilistic reasoning, for diagnosis, etc. So the unintended consequence that I hope does not come to pass is the erosion of the human contact that is fundamental to clinical care, whether it's the physician patient dyad or the intense minute to minute care of nurses who work in the ICU, who spend most time with patients. So that's my hope, that that does not become eroded in the
Does that
face of AI.
does that worry you though, Doctor? That knowing that AI explained about AI being implemented in healthcare, and obviously that could be a concern or not a concern. But my question to you is, do you think it's a necessity, Dr. Cook, that AI will be implemented in healthcare in the future?
Oh, it will be, no matter what anybody will be. AI is here to stay, and will be advantageous in many regards. So I think the imperative is to use it wisely
Hmm.
and understand when it is beneficial, for whom, and how, and when,
Hmm.
and what are the unintended consequences
I know you
that
said
we need to be
I know
aware of.
I know you said that we need it, Doctor. I know you said that it's here to stay. But my question is, do you think it's a necessity, though? Is it a necessity to have AI being implemented in healthcare? Because we were doing so well before that. I mean, we can have that debate saying that, AI before, you know, we were doing so well for the last 50 years. Do you think it's a necessity?
I don't think it's a necessity, but it's a sort of imponderable question that it's maybe too late to even ask that question, because
Hmm.
it's here, it's in use, and it
Fair
is
enough.
going to be used more and more,
Hmm.
and could be extraordinarily advantageous. It hallucinates AI. There's lots of things that are already not just healthcare, but in clinical research, where it is problematic, making up references. And anyway, there's, as you know, there's a dark side to to everything.
Hmm.
But it's it's here, and it's not going away, and so we've got to use it wisely.
Hmm. Now, obviously, in AI being implemented in healthcare, now people don't, it's a very vague sort of question I asked you in terms of, AI being implemented in healthcare. But in specifically, is it being used in intensive care? Is there anything that AI has been used that's helpful towards you and your team?
There's an interesting way to answer that question, which is acknowledging that AI runs on algorithms, and a lot of times predictive algorithms. And so predictive algorithms are extremely useful to identify, for example, early deterioration of patients on the ward who may, with a constellation of signs or symptoms or lab tests, um, be identifiable as individuals who are going to fare poorly or are beginning a downward trajectory that might prompt earlier or more intensive assessments and therapies. So one could call that AI. One could call that predictive modeling that sort of pre-existed, but that is an example of something that was going on 20 years ago in some centers,
Mm,
and now that has a label of AI associated with it, and is an example of a potentially very useful application.
mm,
So it is being used for acute care, um, and I think already it's great, but it's now that example I gave you has a different name and a different label as being AI associated, but it was possible to do what those algorithms have been doing years ago before that label. But obviously the AI implications are very diverse now. I'm not an expert in all of the different applications.
mm. No, no, I understand. I appreciate your response, Doctor. Now, in terms of, do you think it takes also, I want to go deeper more into AI into this. Do you think it takes, in your personal opinion, takes away the effort of young potential doctors who are going to be potentially be on the ward and at the same time, obviously, studying at university, not having to always, you know, they can easily find the answers or do their essays on completed by AI. Does that worry you at some point that patients are going to be potentially looked after by people that generally are using AI to not always know deep how to be a clinical researcher?
Yes, that is a worry that the reliance upon AI for fact finding in general, or fact
Mm,
finding a particular patient, and synthesis of information for a particular patient, or synthesis of information even for research purposes,
mm,
may attenuate someone's ability to be curious,
mhm,
may erode the patience and persistence that are required to be a thoughtful investigator, perhaps more humane clinician.
mm,
Uh, there is a possible alternative, though, that some efficiencies will be brought to bear in terms of how people spend their time, which in theory could liberate time to
mm,
allow for more of creative work, other types of research, or maybe more time to connect at human level with patients. So I'm not sure which assumptions are the right ones, but there's always as much as a dark side, there's always a flip side. One
mm,
could say anything that saves time could liberate time for other meritorious activities, which a
mm,
healthcare practitioner could be numerous.
mm.
But time is liberated in a different way. Maybe that helps people go for a long coffee break. I don't know. Maybe that, you know. So there's upsides and downsides, and I don't mean to be declarative one way or the other, but it's going to be a ride.
No, I agree. I agree, Doctor. But it's a great debate because obviously, as people like yourself who have earned these accolades, who have earned the right to be a doctor, it just seems. I mean, even as a journalist myself, AI can write articles. AI can write press releases. We don't necessarily have to be on, writing bullet points anymore, paragraphs. We can get an artificial intelligence. I just think, you know, maybe AI should be some sort of marginalized, that not everything can be used in AI because, as you say, people's lives are at risk, and when they're on the ward, they need the full experience support, not just support that someone is using, you know, how do I say, artificial intelligence to teach them.
Hmm. Hmm. No, I totally agree, and I hope that AI does not uh, too much um, dig into the crucial field of journalism
Mm,
and does not get used to fabricate research
mm,
reports. And
mm,
you will know more about the former than I do. Regarding the latter, I've also reviewed articles which were clearly done by humans, written by humans, studied by humans, and the reports are done. There's clearly no AI involved, and seen resubmissions completely and totally um, overhauled, which was a clear indication that AI was used to revamp this report with factitious citations.
mhm,
Clearly, had the authors done this work, they would not have read these references because the citations were used erroneously in
mm,
reference to a sentence. It was all made up. Paragraphs were all made up. And that was quite a horrifying experience to be a peer reviewer on that research
mm,
report. And the peer reviewers had suggested that the article be modified and made suggestions for improvement. And I won't share the details of the article, of course, but it was representative of hard work of a group of people who were struggling to improve care in a healthcare setting in a country. And the revised report was fabricated by AI in large sections.
mm,
And that article, because of all the inherent errors introduced by AI,
mm,
uh, ended up being rejected by the editor. It wasn't my decision, clearly, but the editorial team at the journal said, this can't go ahead as a document authored by human beings
mm,
without that disclosure. And that was a tragedy for those clinical investigators who'd worked very hard for about 3 years to do the work.
mm,
And the report, like any study, is imperfect, but a great effort, and it deserved to be published.
mm.
And it was sad uh, to understand that that article was rejected from that journal because AI was used. Perhaps, I mean, unwittingly, errors had been introduced, but it was profound. So that would maybe get published somewhere else some other time. I don't know, but anyway, that was a flagrant example from just 2 months ago that I was observing.
Mm.
Must be
No, no,
hard for.
no, no, I agree, Doctor. No, I totally agree. Now, another deep question. I want to go more deeper. Obviously, we're speaking about AI, and clearly is the topic of probably the year. People always talk about AI, but they don't actually talk about, the depth of it. Do you think AI will cure diseases in the future? Do you think, because it's so intelligent, do you think it will find cures in terms of cancer, schizophrenia? I mean, you know much more than I do, but it's great as an interviewer to be able to ask someone like you these questions. Do you think we'll find solutions, or do you think we will find, doorways to receive the end goal?
I think it's likely that AI will be a great utility to mine and model large databases, whether they are numerical or whether they're chemical structures. Huge databases be extremely informative, and the multiple testing that can go on, and the modeling, and the requirement for validation, and can be handled so easily. I think it is likely AI will introduce some breakthroughs, and the started to a certain degree. So I think there's lots of hope for it in specific situations, and maybe many more situations than we can even imagine, because we haven't we haven't thought it all through. And again, I'm no authority on AI, um, but it's got incredible potential. And again, we just need to be careful with it, I think, and understand both the upsides and the downsides, because everything has an up and a downside. Every new initiative on the earth has something potential for great.
I respect your answer, Doctor. Now, in terms of humanity, I want to go more into humanity. Do you think at some point we will be able to, not as AI now, let's take away AI. We cannot always use AI, because I think people so say we should use AI to resolve the issue. I think we're human beings are much of intelligence as we are compared to using a computer database, but that time will tell. Do you think there will, do you think humanity will have a longevity in the future? Do you think we'll find, people will start, realizing that health is more, it seems like, health is more efficient or more essential than wealth. Humans will live longer. Do you think we'll find a cure to that as well?
Sorry, I'm not really understanding the question.
Oh,
I'm sorry.
sorry. My question is: do you think, in your opinion, you think humans will live longer?
Do I think humans will live longer in the
Hmm.
future?
Hmm.
In the short term, that's possible. In the longer term, we may destroy the planet, and there may be other catastrophes that shorten our not only our lives as individuals, but our time on the planet. I it's hard to say, but generally speaking, most parts of the world, people are living longer as each decade marches on. Um, but whether that will continue, I don't know. And sustaining that trend, I think is in jeopardy to a certain extent with current world events and climate change, etc.
And my last couple of questions for you, Doctor. Now, a COVID-19, when you were contributing to COVID-19, obviously the world was at a pandemic. The world has never seen such a standstill before. How did you react to it in terms of, obviously, acting as an urgency to work on the N95 masks? What was your intake in the whole situation?
Well, I was very pleased to be a frontline practitioner in the COVID-19 pandemic and standing shoulder to shoulder with all the interprofessional colleagues in the ICU. We worked tirelessly, and it was exhausting and exhilarating and poignant lots of times. But I think all clinicians did what they could at the time. The ICU and the emergency room, in particular, the medical and surgical wards. It was all very, very busy. A lot of activities decreased, like elective surgeries, but the acute admissions continued, and I think our community came together pretty well. Speaking for Canada, we, like many countries, also pivoted to generate research relevant to mitigating the ravages of the virus, treatment trials, secondary prevention trials, diagnostic studies. And so our community tried to rally and gather as much information as we could. But of course, that those studies are still going on, understanding the consequences of COVID-19. They're myriad. They are legacies, a different kind of legacy for those who suffer long COVID. So that work is still going on, but being able to practice, teach, and do research during the pandemic was an honor and a responsibility, and I'm glad to have lived through it and tried to make a difference, like hundreds of thousands of practitioners did. And I was very involved in a lot of data monitoring committees for various studies and the WHO and others. So it was a remarkable experience to live through.
What do you think the world should remember about COVID-19 and learn from, Doctor? What do you think they should learn from COVID-19, that so this situation doesn't happen again?
Number one, pay attention to public health. Number two, try to learn to identify misinformation distinguish that from factually correct, authentic, scientific advice.
Mm.
Number 3, don't take anything for granted in this life. Things can change in a moment, in a month, in a year. Number 4, recognize, celebrate, honor our shared humanity as citizens on this earth. And number 5, whatever you do through the pandemic, after the pandemic, try to make the world a better place.
Did you also lose, Doctor, people that were close to you in COVID-19? Did you lose people that were very very, loved ones and family ones that suffered from this pain?
Fortunately, nobody in my immediate family or friend circle died from COVID-19, but many were very sick. Many colleagues became sick, and patients we came to know and admire greatly and look after for long periods of time, died in our presence. So it was all kinds of tragedy experienced and witnessed and never to be forgotten.
Seems like there's a lot of pain there, Doctor, inside, from what I hear from your voice.
Mm-hmm. Yeah, it was hard. It's a lot of moral distress experiencing it and watching what went on, especially, the end of life care when families couldn't be at the bedside. And we rallied forth to try to engage people to be able to communicate on a screen, and watching people struggle with the technology sometimes, and, watching someone see their loved one for the last time mediated by a digital device, and people having to forego funerals because it was disallowed. It was hard. It was a lot of moral distress to see and watch that. But we did what we could, because we were sort of balancing the public health mandates with trying to make this compassionate, as personalized as we could. So there was solidarity, but there was sacrifice.
And also, Doctor, one final question. Now, do you think, in your opinion, obviously the bullet points that you said 1 to 5 are clearly very useful. Now, if people become very inconsiderate again in the future and they don't take the advice of leading doctors like yourself and other people that tell them the right way to live, do you think a pandemic can happen like that again at any time?
I don't mean to make suggestions about how people should live their life, but um, I do suggest it behooves people to be aware that there will be another epidemic or pandemic, and we must be on guard and remember the lessons learned recently, and again try to distinguish information that's valid from misinformation. Stay vigilant. I hope that in the future we'll have faster leverage of what we've learned recently to help us the next time around.
Dr. Cook, thank you so much for coming on the front line. It was a real honor to have this deep